Hi, welcome to ParentingU, a podcast to help you navigate this amazing journey we call parenting. Today, we're chatting with Dr. Theron McCormick, pediatric allergy and immunology specialist with Our Lady of the Lake Children's Health. I'm Stephanie, and thanks for tuning in to ParentingU. Well, welcome to the podcast, Dr. McCormick.
Thank you for having me. I appreciate it.
We were talking before we started recording that this is your first episode after 5 or 6 years of doing this, and that's incredible because you are one of our rock stars.
Thank you.
And I'm so glad you're here with us today.
Oh, you flatter me. I appreciate it. Happy to be available for you guys to do this.
Well, we're so glad that you're here. We're talking all things about summer safety and kids during the summer, how we can help them just have fun, but also be safe and kind of watch out for things that we may not think about during the school year. So today we're talking all about allergies and more specifically seasonal allergies. So in your specialty of allergy and immunology, tell us a little bit more about yourself and the work you do at Children's Health.
Yes, well, I've been gainfully employed here at Our Lady of the Lake Children's Health, even before it became that name. So about 18 years. And so I've had a lot of experience in the field of allergy and my training and background. I went to LSU School of Medicine in New Orleans for my doctorate degree and did University of Texas in Houston for my pediatric training. And then later I did some time at Texas Children's at Baylor College of Medicine for my fellowship in allergy and immunology. And after that, felt that I had more of a pediatric focus. And so I designed my practice that way. And so when I moved back home from Texas, and my hometown is Gonzales, Louisiana, then I was able to kind of structure the practice with a focus more on children. But as we gathered partners, we're able to provide full service. And so I see a lot of children, mostly with a variety of different allergic conditions. We're talking eczema, we're talking asthma, and of course, seasonal allergies or even chronic allergy nasal symptoms, in addition to children with compromised immune systems, along with eczema and urticaria, as well as stinging insect allergy. That's kind of my spiel there, and I will tell you, this is one of my near and dear subjects. So let's get started.
Well, let's jump into talking about just the difference between summer allergies versus fall versus spring. What's happening around us that may affect kids differently in the summer?
Well, when we talk about allergies, a lot of times most patients and most families refer to nasal symptoms, and kind of in that family is runny nose, nasal congestion, sneezing, plus or minus some eye symptoms as well. So when you go to the summertime, you're really talking about the predominant pollen that's in the air. We have warmer days, really hot days, to be honest with you. So air quality is already going to be an issue with ozone and particulate matter. But pollen in particular is going to be more grass pollen. I mean, we're leaving the tree pollen season, which is spring between February through the end of May. And grass pollen season usually kicks in around February to March and really kicks into gear between April and September. It can still be present year-round, but that's the peak time.
When you say grass, I think about the wonderful smell of freshly cut lawns, or if you live around farmland, maybe harvesting. So is that that's just all around us now, just the overabundance of whether it's your lawn grass or kind of harvesting in the farm area? Is that kind of what you're talking about?
It's really a mixture, absolutely. I mean, most people will pass by on the way home or live at homes in neighborhoods where they have lawns, and a lot of those lawns are a mixture of Bahia grass, Bermuda grass, centipede grass, and those are the ones that are cut. And when it's freshly cut, it's going to push out a lot of pollen, especially in the morning. So those who mow yards in the morning put out a lot of pollen that can be a real concern for a lot of children who are outside playing during that time of day. But you mentioned the other type of grass pollen that forms hay, that's more Timothy grass, and some of the northern grasses. So you'll see those in pastures on the sides of roads, medians, and streets, and they'll be cut by tractors and other large mowers, but they still put out quite a bit of pollen. It's very heavy, especially during these high summer months that we're getting ready to experience.
So it's not the actual physical blade of the grass that people are allergic to, it's the pollen that it's putting out? Is that right?
Yes, absolutely. So
Okay.
The blade can cause some contact irritation for some sensitive individuals. So I played in this grass, my skin's a little red, but it's really the microscopic pollen that you can't see.
Well, how can parents tell the difference between allergies, a summer cold, other just kind of common illnesses? What presents differently in these allergies?
For parents, we tell them to expect, especially for children anywhere from that 6 months of age all the way to 8 to 12, they can expect a range of anywhere between 5 to 10 respiratory infections a year. And sometimes it can be difficult to distinguish between cold symptoms and or allergy symptoms. When you're dealing with allergy symptoms, it's more that prominent, I'm rubbing my nose a lot, sneezing a lot of clear runny nose. And those are children who are not really suffering from fever. Their activity level is still about the same. They may have a cough, but it's not usually something terrible. But unless you're dealing with children who also have asthma as well, which is another allergic component that they can have. But when you're dealing with illnesses, especially during the summertime, thankfully, a lot of those viruses are not as prominent during that time frame. And so a child who's having allergic nasal symptoms, they'll have those at runny nose, itchy nose, and sneezing, but it can definitely complicate into a sinus infection. And that's when the child will start to have maybe discolored mucus, plus or minus, decreased activity level, temperature elevation 99 to 101. And that's usually after progression of symptoms at least 8 to 10 days. And so when you see that, most of those will start off as viral illnesses, but they can definitely complicate into something that will require an antibiotic. So it's usually best to have someone with training to help you decide which is which.
Well, what are some ways that maybe we could prevent these flare-ups? I mean, we're talking maybe not kids who have a severe allergy. There's a whole different protocol for that. But what about kind of our day-to-day? Are there any things we can do to prevent when they're playing outside or running through the grass that was just cut?
Yes, absolutely. So I think first things first, if you already know that your child is going to experience some increased nasal symptoms around February or March, you can start taking some preventative medication prior to that time frame, like 1 to 2 weeks before that season hits. But sometimes that's hard. As parents, you'll have different things on your mind competing for your thoughts. But taking an antihistamine 1 to 2 weeks prior to going into that season can also be helpful. Another thing is to keep an eye out on the pollen count. Going to pollen.com or looking at the National Weather Service, and sometimes they'll have pollen counts, and they'll let you know that this would be a high air quality day, that we're looking at really good sunshine, very hot day, and the pollen count will be high because it hasn't not had rain to kind of wash that down from the atmosphere. And remember, like I mentioned, grass pollen, and particularly summer pollen, is more elevated during the morning time. So maybe plan that activity midday or early evening, but not too late in the evening when ozone pops up. When you're riding in cars, we always advise those families to kind of keep those windows up and make sure the air is recirculating and not pulling in air from outside. You can get a significant amount of air which contains pollen into the car, which can counteract a lot of those symptoms. Indoor-wise, I think we always tell parents to kind of look at their furnace filters, their air filters that they can change in their home if they have those available, to change them out. They'll say good for 4 to 6 months. We usually tell parents a good rule of thumb is to cut that in half and change it then. So if it says 6 months, cut it into 3 months. Or if it says 3 months, about a month and a half, especially if you have a lot of traffic in your home, multiple children, several pets. Yes, I mean, these are things that you want to filter that air for. And so you want a rating. They'll have ratings on there. So we like the ones with the pleats, not just the standard fiberglass filters. And of course, you want to make sure that they're cleaned appropriately. Now, the other thing is when you walk into the home, take your shoes off. I mean, you will bring in a lot of debris and a lot of pollen on your shoes and on your clothing, and remove those clothing that you were wearing, especially if you spent some time doing things outdoors. So think about those children coming in from summer camp or being outside playing, and you know they're done for the day. Let's get out of those shoes. Let's change those clothes, get a bath or shower, and definitely maybe wash your hair if you're available to do, if you can do that, because it's oftentimes overlooked. I'll wash my hair in 3 to 5 days or 7 to 10 days and kind of transfer that pollen to their pillowcase, and that can be a serious concern, and they can just wake up with some of those nasal symptoms. Cleaning their bedding. I mean, washing their bedding, warm to hot water kills dust mites, but more importantly, can also kind of shake out some of that summer pollen. And then last but not least, we tell people if you're going to do any laundry, dry your clothes indoors. because
Oh,
we
yeah.
still have some people out there hanging their clothing on sheets outside. And yes, fresh air is fresh air, but you're also bringing in fresh pollen. And so if
Mm.
your child is having some allergy concerns or frequent nasal symptoms and you're looking for good non-medication measures to kind of implement inside the home, keep these things in mind. I can go on, but I'll stop there for now.
No, those are all really good and things that you probably don't think about often. I know we don't take our shoes off when we come in our house, so that's something we can implement immediately. So that's all really interesting. Well, and you mentioned non-medical, but what are some medicines maybe over the counter that if you're having a flare up or you just want a little bit of extra help, how do parents know how to choose the right one?
You hit the nail on the head. There's so much choice out there, and sometimes you can find yourself staring in those aisles at those stores, like which one
Yeah.
is the best one. I think it depends. I think you always start at the age of the child. If the child's able to take a pill, a chewable, or a liquid, start with that and then look down that pathway. There's not a lot of difference at all between the different oral antihistamines, which is what most families would grab. So we're talking Claritin, we're talking Zyrtec, we're talking Allegra. The three of those are pretty standard. They're very interchangeable. I will tell you that the rapid dissolvable tablets a child can take that, they'll dissolve in the mouth quick. There's a faster onset of action. Problem is they're often sold out very quickly. They're more difficult to find and sometimes a tad more expensive. Liquid, there are different flavors, and so you can use that for smaller children. And I always tell parents, because we get this question a lot, sometimes I'm taking this medication, I feel like my child can get immune to this or get used to this medication, I'm going to switch it up. And that's really a myth. There's really no difference if the child is taking a medication and symptoms seem like they're not as responsive. It's because their symptoms or their triggers are overpowering that level of medication. So there's really no need to switch. So if you are using Zyrtec, you don't have to switch to Claritin or Allegra and vice versa. Thankfully, we have other things. Those are good things to use every so often. But if you frequently have nasal congestion, drainage in the back of the throat, or cough, a lot of times it's best to use an intranasal corticosteroid or something like Flonase or Nasonex and even Nasacort. These medications are available also over the counter, approved down to 2 years of age. And you can take those medications, one spray per nostril for 7 to 10 days, sometimes up to 14 days, and give yourself a break, because repetitive usage of these medications, which usually start working in one day, can be very, very helpful to reduce some of the inflammation that can build up in nasal tissue. So that's another one. And there's a third one to consider, and that's intranasal antihistamines, which, believe it or not, are better than oral antihistamines. As far as effectiveness, they come at a cost, though, meaning they can be a little bit bitter, but using that nasal spray, we're talking the onset of anywhere between 10 to 25 minutes. At most 30 minutes, can last 12 to 24 hours, and it can be very effective in helping to reduce runny nose, congestion, and sneezing. The one that's over the counter right now is going to be Aspipril.
I have had surgery. I have had the flu. I've had everything you can think of, sickness, and have had children and all the gross things. Nasal spray is my weakness. It kills me. I can't do it. I hate it. It tastes terrible, but if it works, it works.
Mm-hmm.
So those are all really good and offers options. I love how you said start with what your kids can take versus so liquid, tablet, pill, and then go from there.
Absolutely.
That's a good advice. What's your favorite thing to debunk about remedies or allergy approaches? There's a lot out there that talks about natural, quote unquote, home remedies. What are your favorite things to say? Actually, no.
Oh, several things. I think we can start with honey, to be honest with you.
Okay.
So local honey is quote unquote said to be helpful for patients with allergies. And I will tell you, local honey or honey in general has antioxidant properties, has some anti-inflammatory properties, and you can take it, can lessen the degree or severity of some cough in some people. That's why there are some honey-based homeopathic cough medications. But the allergy link is it's not true. You have to think about insects in particular. So the whole purpose of flowering plants, like when you see those pretty flowers, is to attract insects like honeybees to come and help pick up that really big and heavy pollen and bring it to other flowers so they can pollinate and they can complete their life cycle. And so if you make honey from that, that is not the type of pollen that causes the problems in people. The plants that cause the problems in people do not produce flowers. They rely on wind. And so that's why we tell people, oh, those flowers are a problem, or that dust on the car is a problem. It's it's that time of year. But the ones that's really the problem are not spread by insects and therefore not honey. And they're just because you're standing outside and it's invisible. So that's one thing we tell people.
Yes, you've heard that a lot. Like, have local honey, and it already has like the properties that can help support it. But so allergies in humans are not caused by flowers.
Yes, that is an unusual thing to be concerned about, or to think about there. And I will tell you another thing that we hear about is the benefits of elderberry. Now, I will tell you, most of the work with elderberry has been done with viral illnesses. And we don't want to misconstrue viral illnesses, symptoms. I have a cold, cough, congestion, influenza, things like that, with typical allergy symptoms. And so you will find parents and patients, and again, we don't fault anyone because you're really trying to be on the least amount of medication possible, to try and find those ways to not overburden yourself and definitely not your children with remedies that can be possibly habit forming, possibly long acting, and things of that nature. And by the way, none of the things I've mentioned so far are habit forming. But going back to elderberry, I will tell you that there is not any significant data that we can honestly recommend and say, look, take this elderberry in any of its forms at high or medium or low dose that is going to be helpful to reduce traditional allergy symptoms as the way we are describing it. So people sometimes will use it for immune system boosters. And again, the data on that is sketchy as well. And what I mean by sketchy, it just means that some of the data is not necessarily applicable to what we see in the real world. I'm not a big fan of that because sometimes I have patients and parents, my children are on 5 different supplements, and we have a discussion about something that we know that will work and can be effective and can be short term. And but they're giving the child multiple things. Just because they're quote unquote natural does not necessarily mean that it's going to be helpful. And so don't do things just for the sake of it being natural. The other thing I think we mentioned this earlier, is that most antihistamines are the same, are going to work very well for most people. So there's some differences that are out there as far as Allegra versus Zyrtec versus Claritin. We find that Zyrtec and Allegra to be a little bit more powerful or more potent than Claritin. And so we recommend those more often than Claritin. So that's a piece out there. And the last allergy myth I would tell you is that we hear this a lot, that I'm not able to get my child allergy tested until they're 2 and above. And that's not the case. Children can be tested at any age. The earliest I've tested and found allergic sensitivity was been about 3 months of age. And so it's just that you need to have at least 2 years of cycles to pick up strong pollen sensitivity. But indoor allergen sensitivity, such as cat and dog and things of that nature, or even dust mites, can be picked up much, much younger. Those are some of those typical myths that we hear as far as traditional allergy.
Yeah, so parents may not have to wait and suffer as long as they think. They can kind of come talk with you or another in the clinic and get some relief. Well, a lot of times in the summer, kids are away from home or at camps. Any advice for parents, maybe packing bags, or if they're traveling together, managing that while traveling? You may not have access to what you normally do. What are some thoughts there?
Yes, travel packs. That's my big thing I tell people. So if you're going to summer camps, get that information on the front end as you signed up. And we bring our medications, fill out those papers at your doctor's office about what can be brought. We're talking all of your typical necessary medications that they will have at the camp. But we're also talking about antihistamines that can be quick acting, like those rapid dissolvable tablets for those children who can take that, or those liquids. If those children have asthma, they definitely need to bring their inhalers with recommendations to use. And of course, if they have any significant allergic sensitivity issues, particularly to foods or stinging insects, they need to bring their injectable or their emergency epinephrine devices that they can bring as well. And so that is something that we tell people to kind of always revisit that and clear that with whatever whatever camp but when you're going on trips, long road trips and things of that nature, you should bring those and have a nice little packet in a Ziploc bag of whatever works for you. And bring a nasal spray, bring nasal saline with you, bring an antihistamine, and bring some type of pain reliever. We're talking ibuprofen or Tylenol, because sometimes headaches will develop. I tell some families to bring some Afrin as well, because sometimes you need some very quick-acting nasal decongestant, because no one wants to be miserable during a trip. And taking it one spray per nostril once or twice a day for 3 to 5 days should be fine and is very safe for a lot of individuals.
That's more nasal spray.
Yes. Well, when you're dealing with children, we want to avoid decongestants because they're just not very effective.
And give me an example of one of those, like a Mucinex.
We actually we can put that in that myth category there as well.
Oh.
So Mucinex has been used quite a bit. I mean, it's got a lot of publicity. It's a very successful campaign for advertising. But it actually has not been very helpful, especially for children who are suffering from nasal congestion, runny nose, and typical allergy symptoms. And we don't even recommend it for children who have colds, viruses, and sinus infections either, due to the lack of effectiveness. There's one quick point I would like to make, that there will be patients and parents who will swear by that medication and say, I put my child on that medication. Let me tell you, it definitely worked. And here's the thing, when you look at huge numbers of children similar to that one child and do that same intervention, it just doesn't shake itself out. So can there be some individual correlation, meaning I did this medication at the same time that the child was improving, or did it actually work? It's hard to say, but when we're making recommendations from the physician to the patient, because parents want to hear that level of expertise that it's been tried, it's been rigorous, it's safe, it's effective, and it works on the majority of children, Mucinex doesn't meet that standard.
Very interesting. I love how you're talking about the large macro view of the data and what is showing to be effective and what may have been effective for one person, like you said, is correlation, but maybe not causation, right?
Correct.
Well, do kids ever outgrow seasonal allergies? I remember there was one time when I was little, my mom would tell me I had an allergy to the sun because I would break out in hives if I was outside a long time. Now, that was a long time ago, but she would always say, you'll grow out of it. You'll grow out of it. So tell me about kids, and do they outgrow these types of allergies?
Absolutely. So yes, children can outgrow. Thankfully, a huge number of children outgrow seasonal allergy or allergic nasal symptoms, as we're using in this term, because they become less sensitized in some instances. But more importantly, they tend to not be around some of the things that they used to be around more often. So if I'm a much smaller child, I have my sphere of influence that I'm interacting with is much smaller as opposed to a larger child in different settings. Plus, the immune system and how it handles allergen triggers changes over time. And so your child is a certain way under 6, pre-pubertal areas as they go through puberty, and then after puberty, things change, the way their body processes allergens and becomes a little bit more resistant over time. So we find that the kids that we have to watch the most closely is the ones that are having some symptoms that are very severe during really early childhood, especially those wheezers, because it's a little less likely for them to shake things. And that's a different conversation, by the way, for food allergens. But to go to your point about the skin reaction, and yes, I mean, hives and welts and things of that nature, they're thankfully very transient, and they happen in about 5 to 10% of people. And most cases are acute. And in our terminology, that means that it lasts less than 6 weeks. And it's usually self-limited, goes away on its own. As you get older, a lot of that kind of just shakes itself out, which is a really good thing.
Is that also why maybe in adulthood you can develop allergies that you didn't have as a child, like vice versa?
Yes, absolutely. You can develop an allergy at any age, especially becoming allergic to foods of that nature. It's much more common in children, but we do see adults developing food allergens, especially to nuts and seafood and certain additional things like sesame, which is really taken off of late. But going back to pollen and as far as seasonal allergies and nasal symptoms, we've seen that post-pregnancy quite a bit. And also we've seen it in some adults over 50.
So it's not necessarily something you're born with. As your body changes, so can your allergies.
Yes, absolutely.
When should a parent, I don't want to say worry, but when should a parent, if they're noticing kind of continued reactions, when should they make the call to your office?
Well, I would say that when it's difficult to manage those symptoms, like you've tried that intermittent usage of Claritin or Zyrtec, plus or minus a nasal spray, depending upon their comfort level, and they find that they're giving that child that medication nearly consistently. Or here's a good test question I would put out there to parents: if we stop this medication, how long do you think your child can go without that before you start to see symptoms? Oh, just 2 to 3 days. Well, that's a concern. Those patients and those families, we encourage to reach out to their primary care physician so they could be referred to an allergist or come to an allergist so we can have a discussion about triggers, about nasal symptoms. Another situation is those children who are frequently becoming ill. I will tell you, allergic inflammation meaning children who are allergic to things indoor and outdoors, who have seasonal runny nose, congestion, and sneezing. Those children are much more prone to have recurrent ear infections, or have fluid just kind of sit in their ear, and so they resolve a lot slower. And then another situation is that they're more prone to sinus infections, headaches, worsening of migraines, and something that's often overlooked, but something that parents may not know, is that children who frequently have nasal symptoms or allergy symptoms, oftentimes more than 40% of them don't sleep very well. They toss and turn, they may snore, and that negatively affects them as they go to school because their attention is not where it was. They're a little bit more irritable, and so that can impact learning. And so, but I want parents to know that that's another reason why we want to treat. But those reasons to get to see us are just difficult to manage symptoms, those recurrent illnesses, and especially those children experiencing complications.
Grown-ups need doctors too, and kids need their parents to be healthy. Building a relationship with a primary care provider is one of the best things you can do for your own health and for your family. Our health system makes it easy to find care that fits your life with extended hours, video visits, walk-in clinics, and same-day appointments. Whether it's time for a checkup, a screening, or care when you're feeling under the weather, our team is here to help you stay well. Visit doctors.fmolhs.org to connect with a provider near you.
Well, before we talk a little bit about food allergies, because I know that's an important topic as well, is there anything else in the summer that we would want to kind of think about? Like, I'm thinking like sunscreen that people may have a reaction to, bug spray. Are there any kind of common things that you see in those products that we typically use more in the summer versus another time?
It's a longer discussion about contact irritation with sunscreen, and you want to find any sunscreen that you use, you want to definitely test on the skin to make sure the skin is not going to react and become a little bit more irritable because of it. And of course, follow those rules. SPF 30 to 50 is really all you need, and to reapply frequently. But the thing we see the most is, should I use insect repellent? And we see a lot of mosquito bites and large local reactions to insect bites and stinging insects during the summer months, because we live in a part of the country where we have fire ants, and some children and adults will have bites and stings to fire ants, which can be locally large and quite concerning to some families. Thankfully, they don't represent serious allergy, but other times we worry about they can be a lot larger, and we have to see those patients in our clinic. But when you come down to mosquitoes and things of that nature, we definitely look at products that contain Picardin, Picardin, or DEET, not the DEET that's in off, which is oftentimes a little too weak, but Deepwood's off, which can contain up to 40% of DEET, or up to 50, like we see in Repel, which is another one I frequently recommend, and reapply those areas to the areas that are exposed. And so that can be something that we do very often, as far as to try and reduce some of those allergic reactions.
What to look for in those types of things, I think any parent is thinking about, because again, you're standing in the grocery store aisle and there's 80 choices. So knowing what to look for, I wrote that word down. We'll put it in the show notes as well. Okay, well, let's talk a little bit about food allergies, because I know that's another big part of how you help with kids and what they're dealing with. Do kids who have seasonal allergies have a higher chance of developing food allergies? Do they kind of coexist? Or is that another myth we can debunk? And what should parents know about managing both seasonal and any food allergies?
It's actually not a myth. This is a real phenomenon. We can see 30 to almost 40% of patients who have seasonal allergic nasal symptoms or allergic allergen and eye symptoms, they can develop food reactions. It's actually a well-known phenomenon in the allergy world called oral allergy syndrome or pollen food allergy syndrome. And what happens is as you're already sensitized or allergic to certain pollen, let's say birch tree pollen, for instance, a good 30% of those patients during the birch tree pollen season, due to shared proteins or very similar proteins between the birch tree pollen and certain fresh fruits and vegetables, when they eat those foods, it can cause mouth irritation, itching, feeling like there are little lumps in the throat. Sometimes it's a little bit more uncomfortable to swallow, and maybe even some itching and rash around the mouth. Thankfully, the overwhelming majority of those cases are very, very benign and very self-limited, but some can be a little bit more serious. And so a classic example would be to be allergic to birch tree pollen and eat a fresh apple or eat fresh cherries or apricots or pears and experience these symptoms. And we see that with grass sometimes as well, especially with melons like watermelon or cantaloupe and things of that nature.
Things that grow close to the ground.
Yeah, well, yeah, absolutely. But more importantly, that they share very similar proteins as they were kind of developed over time. And so those protein similarities are the reasons. And incidentally enough, when you cook or bake those foods, the protein is broken down, and that's why that food is not a true allergen. It's just a protein similarity. So when I see those children, I would test for birch tree pollen, not for the cantaloupe or the pear or the apple.
So again, it's not the physical item of the food, the cantaloupe, it's the protein that mirrors the protein in the pollen.
Absolutely. That's it. And then that can be treated with an antihistamine. Cetirizine or Zyrtec can be used immediately at that scenario. So that's something that we do and do very often. And then when you go back to traditional food allergies, especially with children, the ones that we're most concerned about are nut allergy, seafood allergy, especially in this region. And then, of course, the more common ones like milk, peanut, and wheat can be, and also sesame. So these are the other allergens that are out there. And so we want parents to just be aware, watch out for cross-contamination, and have some form of epinephrine to have available. And we used to say injectable, but now there are various versions.
So it's not always necessarily an EpiPen.
Correct.
Well, what about asthma? I mean, I know we could do 3 episodes on asthma, but what should parents know about seasonal allergies triggering asthma or coexisting with asthma?
Yes, and I think that starts with that family history, especially if one of the family members or a sibling in the household already has a history of asthma. So you take that into account in the child we're dealing with who has allergic nasal symptoms already, then that risk is pretty high that child can develop wheezing or coughing episodes due to inflammation or aggravation inside of their lungs, which needs to be treated and addressed. And so those same triggers that can cause nasal congestion, overproduction of mucus in the nose to make you have runny nose or mucus in the back of your throat, or sneezing, that same type of process can cause closing in the airways, and that's what makes it harder to breathe. And when you wheeze, you can have mucus in those small airways just whistling past those areas, and that's that wheeze sound. So it's very similar. And so those same triggers are like tree pollen, but especially grass pollen of various times. We want those parents to address that and wear protective gear if they can, like things for their eyes, mask when necessary, especially if they want to participate in outdoor lawn care or mowing yards and things of that nature, wearing gloves, and doing those same processes to prevent those allergy symptoms can be very helpful for those patients who also have asthma.
I'm sure along the way, as you kind of talk through the family history or kind of the recent history of the child, are there things to think about of like adjusting the asthma treatment for different seasons? Do you up medicine? Do you do different things? how do the seasons affect that asthma?
Yes. So asthma, it's like you mentioned, you can do separate podcast on, but you mentioned that as far as certain seasonal spikes, we're helped with that with the usage of allergy testing. So if we can detect allergic sensitivity to tree pollen and weed pollen, then we can tell families to have a plan that we need to ramp up therapy much more consistently during the springtime and the fall. But if they're more grass pollen allergic, we will focus that increased usage of medication during that time frame, let's say February, March, all the way through September, just in anticipation of things. And so that's how that the testing can help us understand that. But ramping things up as far as using the medication, I think something that some families are really starting to let us know that we don't want our children on medication all the time. And thankfully, they do not need to be on it for long months at a time or huge stretches of time. We can definitely do intermittent plans. And so sitting down with skilled allergists, immunologists who can talk with you, come up with an individual plan based on your trigger profile and your allergy profile, and figure out that best plan that works for the family, for the child, and that also does not overburden that child's system.
Was there anything else that you wish parents would know about seasonal allergies, or anything that you think would make a difference in their kind of quality of life during what is a very hot and sometimes we can say very long season?
Yes. So don't discount or underestimate the benefits of good sleep at nighttime. And so sometimes, well, a lot of times children get out of their sleep patterns during the summertime. And so things are thrown off quite a bit, and they will jump into bed and not take baths as regularly and things of that nature. And all of a sudden we're having more nasal symptoms and trying to figure out what's going on with the headaches and a runny nose. When we do those simple steps like taking those shoes off, coming indoors, getting that bath in or shower, changing that bedding, especially, and then when you have the chance to wash your hair, do the same with that. And if you have pets, of course, washing them 1 to 2 times a week, I would say. Sometimes it's not practical, but if you can have air purifiers in those homes, that would be also helpful for families, especially with a lot of foot traffic, the ones with the removable HEPA filters. So we do encourage that for those patients and families who have those type of homes. And also just being mindful of the medications. I tell parents, none of this is habit forming or addictive, and talk to your allergist, come up with a plan. We're going to do this for this amount of time, for this measure, for this reason, and it is safe because of X, Y, and Z. I really try and go through all of these things with some of my families because as a parent, as a father, you really want to put yourself in those shoes of those parents as they try their best to manage those conditions that children often go through.
Well, here's my last question. What's your favorite thing about summer?
My favorite thing about summer, I see a lot of food allergy follow-ups as far as my profession, but during the summertime, just when I'm outside of the office, just taking it easy with my family, cookouts, and just relaxing and going on trips. So I think those are my favorite things.
Well, thank you so much again for your time. We'll have everything you talked about linked in the show notes. A lot of the resources you mentioned I think are incredibly helpful. And thank you again.
Sounds great. Thank you again. Let's do it again sometime.
Thanks everyone for listening. We'll be back soon with another episode of ParentingU as we continue to navigate this amazing journey we call parenting together. See you soon.